Coronavirus antibody tests have really terrible accuracy, researcher says. Some antibody tests, which check for prior COVID-19 infection, had high rates of false positives in screenings performed by a consortium of California laboratories, according to a recently released report. A false positive means someone would be told they'd already had coronavirus when they had not, a potential danger as people could then think they were immune to the virus when they're actually still vulnerable. Of the 12 antibody tests that were studied by the COVID-19 testing project, one of the tests gave false positives more than 15% of the time, or in about 1 out of 7 samples. 3 other tests gave false positives more than 10% of the time. That's terrible. That's really terrible, said Dr. Caryn Bern, one of the authors of the study that looked at the 12 tests. She said while it's unrealistic to think all tests will be 100% accurate all the time, their false positive rates should be 5% or lower, or ideally 2% or lower. This was a real wake-up call for me. We're not at the point where any of these tests can be used reliably, added study co-author Dr. Alexander Marson. There's a big danger in relying on them at all, but we hope we get to a point soon where we can rely on these tests. The COVID-19 testing project is a consortium of researchers and physicians at the University of California, San Francisco, the University of California, Berkeley, the Chan Zuckerberg Biohub, and the Innovative Genomics Institute. A rocky road to antibody testing, Bern said one of the reasons for the high false positive rates is relaxed requirements from the U.S. Food and Drug Administration. In mid-March, when it became clear that COVID-19 was starting to whirl out of control, the FDA loosened its approval standards in order to get more antibody tests out on the market quickly. The agency started to allow companies to sell tests without first providing evidence that they worked. Some 175 test developers have taken advantage of these new rules and can legally market their antibody tests without first having their validation data evaluated by the FDA. I think we're paying for this now, said Bern, a professor of epidemiology and biostatistics at UCSF School of Medicine. After a major lab association complained that crappy tests were flooding the market, FDA Commissioner Drive Stephen Hahn issued a statement on April 18 saying the FDA would collaborate with the U.S. Centers for Disease Control and Prevention and the California researchers obtained as many tests as possible, but so far have been unable to screen antibody tests by large test makers such as Roche and Abbott because they require proprietary instruments to run the tests, which the California tests did not have. They hope to continue screening more antibody tests to see if they work, but warned that even if a reliable test shows you have antibodies, doctors still don't know what that means. Having antibodies could indicate you're immune and won't get infected a second time, or it could indicate you have no immunity at all. It could also mean something in between, for example, that you have some limited immunity for a period of a few months. We have this huge knowledge gap, Bern said. That's the most important message. Dr. Manali Nigam and Arman Azad contributed to this story. Click subscribe to receive the latest news.